So I'm doing my presentation on heart catheterization. Heart catheterization began in 1929 when Werner Fossmann did the first heart catheterization on himself. He numbed his elbow and thread the catheter to his heart, and he confirmed the placement, and he was able to perform the first catheterization. And the goal was to find a way to perform cardiac resuscitation. The reasons to do a cardiac catheterization are to clear blockages from the heart and prevent damage and death. Blockages can be caused from high cholesterol, fat, and toxic buildup in the vessels of the heart. To do a cardiac catheterization, generally the patient has testing done, such as EKG, x-rays, and blood work to check to see if the heart is experiencing any damage. If the heart is experiencing damage, or if they feel that there is a blockage, then they will go ahead and perform the procedure. The patient will be given a mild sedative and will still be conscious but in a twilight state. The doctor will make an incision at the femoral artery and thread the catheter up into the heart using an x-ray to guide. Once there, contrast will be entered into the heart and into the vein so they can see any blockages. If they find blockages, the catheter will be threaded to that spot. A balloon on the end of the catheter will be pumped up, opening up the vessel, and the blockage will be cleared. Then the doctor can decide if they want to use a stent. A stent is a small mesh-like metal device that is placed in the vessel where a blockage previously was and is used to hold open the vessel and prevent further blockages. If a stent is used, the doctor will place it and then they'll take the catheter out. The nurse will have to hold pressure at the incision site to prevent heavy bleeding loss, generally 15 to 20 minutes. After that, a dressing will be applied and the patient will need to stay at least 1 day in the hospital to have further testing ran and repeat blood work to make sure that the heart isn't experiencing significant damage. As long as everything looks good, the doctor will generally release the patient and they will just need to follow up generally within a month, and then after that maybe every 6 months, and then a year after that. Treatment options after that generally are lifestyle changes such as exercising and diets, and most patients have good prognosis and don't have any long-term damage as long as the blockage was cleared out in enough time. If blockages aren't cleared out in enough time, a heart attack can happen, in which case the patient is at more increased risk of heart damage and even death. If a patient experiences further pain, they need to see their cardiologist and be tested again to make sure there isn't any more blockages. If the patient is good, then they'll just follow up, and any blockages that are minor will just be watched closely. Generally if the blockage is about 70-75%, the doctors will go ahead and clear that one out. If the blockages are below that, they're generally just checked up on every 6 months to a year. And like I said, if patients are experiencing any problems between them, they can generally come in to be checked on throughout that. The pros of having it done is to prevent cardiac arrest, to prevent heart attack, and to prevent any kind of heart damage. The cons are that there is a risk of bleeding and there is a risk of heart damage if not done correctly. And Generally, the doctor will weigh out the pros and cons, and they will choose what's best for the patient. If there's still damage, or if they're unable to clear out the blockages because there's too many, or because they cannot get to the blockage if it's in a hard spot, then they can refer them to a cardiac surgeon for a heart bypass. And that is my presentation on cardiac catheterization.